A patient has a painful lump in the neck and he has undergone a lymph node biopsy, and after that what do you find? Winging of the scapula is the classical thing, with the sagging of the shoulder, which is the classical feature whenever the accessory nerve is the one which get typically injured. Now doctor, a 57-year-old, 6-month history of significant weight loss, and he has sensory loss in the area which is being shown. What is this area? It is the area which is covering the jaw. So jaw is an area which is basically supplied by inferior alveolar nerve, which is a branch of the mandibular division of the trigeminal, and the mandibular division of the trigeminal will be passing along foramen of ovale is what you have to basically appreciate. A 64-year-old retired headmistress fallen down, fracturing her right fourth rib, as what you can see, the intercostal nerve which passes along the lower border of the rib. And what is the innervation which is from the intercostal? It supplies the general somatic efferents to the transversus thoracis muscle of the thorax is what you need to basically appreciate. Now you have been shown an electron microscopic organelle which is basically a lysosome. A lysosome typically has got acid phosphatase as its important biochemical enzyme marker. Now if you take the lipid soluble high molecular weight alcohols entering the cell without using an energy dependent process, what is the typical type of membrane transport called as? It is a non-carrier mediated transport. If you take the active transport, it require energy, etc., etc. So you can review the literature of the remaining types. A 16-year-old boy who is a class topper complains of muscle cramp whenever he exercises. Class toppers generally exercise their brain and very little of their real muscles. So when the cramps are very severe, his urine turns red and the blood glucose is normal and he has got a normal serum lactate after exercise, then what is the enzyme? So these glycogen storage disorders. Which glycogen storage disorders affect the liver and also muscle? Which will lead to lactic acid elevation on exercise, which lead to recurrent hypoglycemic attacks. So the differences between the 7 types of glycogen storage disorders, you need to have a hold on it, because that is one topic which is going to be definitely asked in the tomorrow's exam. So this is all the description of McArdle's. McArdle's is myophosphorylase of the muscle, which is deficient, is what you have to basically remember. Now you have been shown the mechanism of action of a toxin. So what is this toxin doing? Adenylate cyclase activation, which is the basis for the cholera, Vibrio cholera. Did they give you in the exam this image or other image? Oh, already it is written cholera toxin there. Cholera is not there. Only toxin is there. Ah, good, not bad. So recently we have we finished a crash course on DNB. Last 15 years of DNB, 30 question papers we discussed topic wise, and our students have gone for the DNB exam. My WhatsApp was full with messages that 85% of the paper is what as we predicted, and we are able to crack it confidently, and some of them were feeling little sad that probably if they would have revised better the videos and the class notes, they would have done much better. But the point is very simple. All exams, all entrance exams, 70% to 80% are predictable question paper. All our preparation must be consistent answering of that 70-80% of predictable part of the paper. Okay, doc. So there is a reason every paper that we set, we do a lot of research to make it as close as possible to the real exam, but at the same time we will make it little tougher in December, January, to give you a sort of a competitive spirit to rise and study. Once more in January, February we will make it more diluted, so that you almost will have it like the actual exam paper. So that is the reason every week identify where you are going wrong. So Dr. Mycolic acid, this is a Gill-Nielsen stain. If you take Mycobacterium, it doesn't stain with gram, but it stains with the Gill-Nielsen, which is based on the presence of the mycolic acid, is what you have to basically remember. Now doctor, a 14-year-old boy ingests the food that has been contaminated with a gram-positive organism. Then what is the gram-positive organism's mechanism of pathogenesis? So they do not have an outer membrane, and the peptidoglycan in them has got a N-acetylmuramic acid, and it is a lysosome that cleaves these components of the cell wall, leaving the bacteria unprotected. That is the underlying basis of the immune reaction. Now, out of the 90 people who had consumed the cheese, there is a development of food poisoning. I mean, the vomiting, etc., etc. I mean, the development of meningitis, etc. A good number of them are typically pregnant women or elderly or immunocompromised, a very important clue. So it is a catalase positive organism, and it grew beta hemolytic colonies which are motile, and what is being shown to you in the picture is gram positive catalase producing pleomorphic cocoid and rod shaped bacterium, which is basically listeria, is what need to be remembered, and which produces listeriolysin. Now the challenge of this question, this kind of question, when it comes tomorrow in the APPG or any entrance, I am 200% sure even MD microbiology cannot make a diagnosis looking at the slide that it is listeria. So in all image based questions, you should depend more on the history of the clinical vignette which is being given. Image is only just to add a slight confirmation. So recent AIMS exam also, if you have seen, there were 58 images in the image based questions in the AIMS November 2015. So those who have not attended that discussion, it is available in our anatomy2medicine.com video library. You can review that. Most of the times the question story itself will give 90% answer. Image is only 10%, be sure. So 30-year-old with frequent urination, dysuria, dyspareunia produce colorless colonies on the McConkey agar, and the urine culture on the blood agar is being shown to you. What is so classical of this? You can see rings, no? That's called swarming growth pattern. Swarming growth is the characteristic feature of Proteus mirabilis, is what you need to remember. Even if you don't recognize this as swarming growth also, you can easily recognize it based upon the history. That urinary tract infections means commonly E. coli or Proteus. So it is producing colorless colony on the, that means it is a non-lactose fermenter. So that makes you to clinch the diagnosis as Proteus mirabilis, is what you need to basically appreciate. A 78-year-old who has got a cardiac failure has been receiving digoxin, and it is estimated that the digoxin half-life based on his creatinine level, it is thought to be 4 days. Then which pharmacokinetic parameter is very important for deciding the loading dose? Once more doctor, every APPG, Tamil Nadu PG, Kerala PG, any PG you go, one question on VD, volume of distribution, loading dose, maintaining dose, half-life, first pass metabolism, and first order and zero order kinetics. 8 to 10 issues will be there in pharmacokinetics. So reading entire pharmacology is a wishful thinking, but definitely finishing that pharmacokinetics is tomorrow also useful for you in the clinical practice. So there is a reason, please review, one question will come, it is a volume of distribution. Because what is the formula of loading dose? Volume of distribution into target plasma concentration will give you the loading dose. That is a deciding factor, right? If you go to the AIIMS, they give a little more complex question of numericals and ask you what is the infusion rate to be calculated. That is beyond the imagination. But at least a single liner question like this, what decides loading dose? Loading dose is equal to volume of distribution into target plasma concentration is what you have to basically remember. Now a 45-year-old woman, please punch into the chat window the users to refresh the browser. Please do that. I hope the online students, the voice is loud and clear with a clear transmission. Can you please punch? How is the voice loud and clear? So we have got about 100 plus audience in some of the centers where the students are attending. So I hope the things are clear. Now, a 45-year-old woman, unusual appearing mole. You have done the wide excision biopsy. It's a classical histological appearance of malignant melanoma. Is the atypical dysplastic cells with a hyperchromatic nucleus is the basis for diagnosis of any malignancy whenever you look through the microscope. Now, in a clinical trial, you are testing the hypothesis that high levels of vitamin X increase the incidence of the bladder cancer. And the incidence of the bladder cancer was higher in the people taking vitamin X supplements as a part of clinical trial than in those who are receiving placebo. But this difference is not statistically significant. So what is the accurate conclusion of it? Obviously, statistical significant difference is the essence to prove the hypothesis, null hypothesis as true or false. Null hypothesis, what does it assume? It says that there is no difference. Whether you take coaching or no coaching, take mock test or no mock test, no difference is the null hypothesis. But those who have taken mock tests have proven that they are standing in the top 100 ranks, provided they stand top 100 here at least, right there. So then you disproved it. So statistical significance of difference is an important parameter that need to be proven before calling it as a significant difference is the whole story. Then a study of 20 adults with attention deficit hyperactive disorder and 20 age matched adults without ADHD, they have shown an increase in the dopamine transport protein density. So which is the type of study design that will provide a correct picture about the association between this dopamine transporter mutation versus ADHD out of all these various study designs. This session is too small for discussing each of the study design. I leave the literature for you, just review. It's called affected sibling pair study. It is also called a concordance study in the other name, right? So just review it to get a better clarity. Now, a young woman performs a home pregnancy test. The test indicates that she is not pregnant. She wants to know the probability that the test is correct. What test characters talk about the probability of the correctness of a given test? So, fundamentally, we are talking about the probability of the correctness of a positive test or negative test. Negative test. That's the reason it is the negative predictive accuracy. There is no big deal. Probably some of you might have answered sensitivity or specificity or positive predictive accuracy. Just review why it is not so from the literature. Now, the IV drug use and positive HIV serology patient presents with periarthritic joint pains. And he is also having a lesion like this. What is this lesion called? Keratoderma blemoragica is the name which is being given, which is a very classical feature which is seen in the case of the reuters, where chlamydia is basically implicated. 45-year-old Lakshmi from Madurai comes to the emergency department with the shortness of breath, and she says, I have paroxysmal nocturnal dyspnea in the night time. Unless I keep 3 or 4 pillows below, I am developing orthopnea. Then you got her catheterization done. So what is the very characteristic feature of this picture, which suggests that there is a mitral stenosis? Mitral stenosis is a typical hemodynamic problem during systole of the heart or diastole of the heart. When the ventricle fills with the blood from atria which is flowing into it, during the diastolic phase, the flow is not smoothly flowing because of mitral stenosis. So this left ventricular curve which is showing elevated pressure is the systolic phase. This is the diastolic phase. Generally during the diastolic phase, what should happen to left atrium? Normal people may. Left atrium should vomit blood into left ventricle, and left ventricle should get pregnant with the blood, and pressure should rise in the left ventricle. Left atrial pressure should fall, right? But in this case, what is happening? The left atrial pressure during the entire diastole is remaining higher than the left ventricular pressure. When will it occur? If there is a mitral stenosis which is causing obstruction for the flow of the blood from the left atrium into left ventricle, then the left atrial pressure curve will be constantly, it will remain higher than the left ventricular pressure, and that is how you recognize the presence of mitral stenosis whenever you do. Some of you are going to be top interventional cardiologists within a short period of time. Dr. KSR is asking, sir, 50th question answer, why not A? 50th, let's go back to 50th. Why not A, which is Campylobacter jejuni you want to propose as a cause of what? He was basically it is a non-gonococcal urethritis, no? Campylobacter jejuni also is implicated to be responsible for reactive arthritis. Even chlamydia also is implicated. But in view of the urethritic picture, the likelihood of considering chlamydia as the answer is more likely. I hope KSR will be happy about it. Then now doctor, a 35-year-old woman comes to the clinic because of a 4-day history of pain in her joints. Examination findings are shown in figure. What do you find? There is a malar rash on the cheeks, and there is a oral ulcer. A malar rash, are you able to appreciate that rash? On your mobile phone, smartphone, they will put all these images in a blog on the News for Medico and give you the address of that blog. Have they given? In the beginning they will give. Diya ya nahi diya? Nahi diya. He might have posted, no, in the front. Given, no? So what you do is, while answering on your smartphone, because paper-based students, just open that link, you will have all images, colored images available. Why to waste papers in color printing, right? I thought once online exam become online, Many students will not come to paper-based exam, I thought. But still paper-based will give you chance to going to a temple, where you have that studiousness to sit for 3 hours. So still students come and take a paper-based exam. So for your advantage, we put it on the blog. Please don't forget, next time onwards, whenever you are going through, parallelly go through the images. So, malar rash with oral ulcer. So what is your diagnosis? SLE. SLE means anti-DS DNA is the most specific test for the SLE, is what you have to basically remember. A 49-year-old is brought with a sudden severe dull boring mid-abdominal pain radiating to the back, and he was having 5 bottles of beer every day. Then what is the most likely possibility in his given case where he is showing hypocalcemia? Alcohol is a risk factor for pancreatitis, and pancreatitis, one of the complications is development of hypocalcemia, is what you have to basically remember. 69-year-old who has got a fatigue and a lower back pain and reporting problems urinating for the past few days. There is a percussion tenderness on the vertebrae and rib cage, and there is a prostate gland enlargement, and the laboratory findings have been given to you where serum calcium is showing 12. And typically what do you see on his peripheral smear? Rulex formation. Whenever your pathologist calls you and say that there is a Rulex formation on the blood, if you don't go back to the patient in the ward, you are MD General Medicine, right? If you don't go back to your patient in the ward and ask him, recheck him for a possibility of multiple myeloma, you are missing a red flag. A good number of times it is the pathologist who will raise a red flag. They say that there is a Rulex formation, आप कभी multiple myeloma सोचा है क्या है patient के ऊपर? So then we will go back and then recheck, and we will find all features present. ESR high, anemia present, lytic lesions in the bone, everything, you will have a classical picture. So that is the reason tomorrow when you do MD, ignore any of your friends but not a pathologist, right? He is the one who is going to save you on the ship any point of time. And don't depend too much on anesthetist. Learn how to intubate, learn how to put central line, and you don't need an anesthetist, right? Because anesthetists are so busy, guys, that most of the time is taken away by surgeons. So tomorrow you are a gynecology obstetrics, your patient went into cardiac arrest, she had a postpartum cardiomyopathy, or she has got an eclampsia. You must be in a position to do intubation and save the patient. So if you say that call for the help, and 108 if you call, nobody will come. So that's very important. So malignant plasma cell disorder, multiple myeloma. Now doctor, 21-year-old, sudden onset of itchy red rash on his body. He had been taking an antibiotic and he had no known allergies. And typically what type of rash this is? Maculopapular rash, which is classical of infectious mononucleosis. If you happen to give ampicillin to the patients, then typically they end up in developing a maculopapular rash. And what is the possibility in an infectious mononucleosis patient clinical examination? They will have a splenomegaly and an exudative pharyngitis. Kissing disease is the name given for the infectious mononucleosis. 50-year-old developed a fever and persistent cough productive of blood-tinged sputum. There is a snowstorm calcified lesion like mass in the right lower lobe. He has undergone thoracotomy, and the frozen section of the lung, Gomery stain. What is it showing? It is showing intracellular yeast organisms, and there is a granulomatous inflammation. So which organism you think lead to in a lung a intracellular yeast with granulomatous inflammation? Histoplasma. To counter the histoplasma like intracellular yeast, what is the most important mediator in our immune system? It is the interferon gamma, which is the most important mediator, is what you have to ultimately understand. A 2-year-old boy is referred to the tertiary hospital with a history of recurrent otitis and upper and lower respiratory infections with eczema, with nose bleeds, with bloody diarrhea. Somebody is having eczema, thrombocytopenia, immune deficiency. What else? Wishkon-Aldrich syndrome is what you need to be very sure. And remember me, doctor, you will remember me in exam hall. One of these immunodeficiencies, Bruton, Digeorge, Wishkon-Aldrich, Skid, one of them will definitely come. Young syndrome. So all these 2 pages in Ananthanarayan and microbiology, all these immunodeficiencies will be discussed. So please take a chance today evening only to review. Definitely one question is going to come. Now doctor, a 8-month-old girl is brought to emergency with elevated fever. Fever itself is elevated state. Where is the elevated fever? Indian English. Huh? And signs of sinusitis and otitis that have persisted for 2 weeks, and T lymphocytes are normal and the response to T cells, mitogens are also complete, then what is the possibility? And there are elevated level of circulating granulocytes. Once more, the whole story goes in favor of Bruton's agammoglobulinemia, where humoral deficiency is the problem but not cell-mediated immunity is not affected. So all the immune deficiency disorder which are cell mediated deficient, which are humoral deficiency, which are combined deficiency of the two. You are going to review it today evening itself. Okay, doctor? Right. KSR is asking, tomorrow do we have APPG? Yes, we are having a big mela of APPG. Last 20 years of question papers, topic wise analyzed, organized and discussed. It starts with medicine from tomorrow. I hope you all have the schedule of it. So please do come, and there are for example general medicine, around 1400 questions in the last 20 years, around 1100 questions after repetitions removed. Then similarly, so totally around 7,000-8,000 questions are there if we take all the previous APPG. Similarly, Tamil Nadu PG question bank also is an excellent question bank, and our examiner in AP and Kerala and Karnataka, they borrow the questions from one and others state question banks. So it's worth it to steal the others question bank also, review those questions, so that once more the chance of their resurfacing are very high, right? So we have both the Tamil Nadu PG question bank and AP PG question bank last 20 years, analyzed, discussed and delivered subject wise. So you can go through the schedule. Morning 9 to 7, we have got excellent team of faculty now. Orthopedics, Dr. Selvarajan, and ophthalmology, Dr. Rajaratnam, and Shailender, and so many excellent teachers. Of course, general medicine, I don't let anybody to teach. I will only teach general medicine, psychiatry, dermatology and radiology. All the remaining subjects you have good teachers, so please do come and take an opportunity. Now doctor, a medical student believes that a resident is disrespectful and judgmental towards a patient, and he feels angry and has the urge to verbally attack the resident. He decides to get feedback from his peers. अगर मैं उसको डांटे तो वो क्या करेगा बोल के he will ask his friends. So the student's behavior is an example of what? It is basically called suppression. Suppression. So suppression is a voluntary postponing attention to feelings and impulses that we have. We feel like kissing somebody, but every day we will be waiting in the class for a right day to come to do that. So though the impulse is there, we know how to suppress the impulse. That is a mature defense. Denial is refusing to acknowledge a anxiety provoking event. Suppose if tomorrow exam is there, people go to movie today and say that, yeah, I am very confident, so I am going. Actually the point is they don't want that anxiety provoking scenario of tomorrow to creep into their mind. Then comes the isolation. where you separate painful feelings from the stressful situations. You may have stressful situation. See, if you are doing a night duty, back to back another night duty because your friend didn't come. 36 hours is one night duty, and once more you are in the same apron with the stinking body. You have to go around to do the next night duty, and you have got about 4 acute MIs. Then what will you do? You can't anyway escape that stressful scenario. So you will wash face and try to separate. Stop feeling about that situation. After 72 hours is over, then your swollen limbs will make you, the feelings will come later. So we may have so many stresses in life, but we have the ability to not feel in the stress. That's how some politicians, while going to jail, they will say bye to everybody, smile, and then they go. They don't let the feelings of stress to come in. So that is isolation. Then repression is altogether blocking the unacceptable impulses and painful feelings from conscious awareness. That's very important. While preparing for exam, don't think of failure, the day I fail, etc. They have no meaning at all. Anyway, if you are bound to fail, you will fail. Nobody will help you. If you read anyway, you will succeed. No one will stop you. Simple rule. So, unacceptable and acceptable defense mechanisms. I leave the literature for you. Now, 59-year-old has a strong anxiety reaction whenever he hears the sound of a helicopter, because he was seriously wounded during the floods of Gangotri. The fear that this man experiences when he hears the helicopter sound is basically called as what? Conditioned response is what you have to basically remember. So every time after a neutral stimulus like a sound of a helicopter is paired with a unconditioned stimulus such as the threat of death, then every time that sound comes, the threat of death will keep coming is what you need to remember. This used to be the basis in long ago in the schools. They used to cane the children. So that riff sound, I still remember as a child, the maths teachers, riff, that sound itself, though others are beaten, still used to make me so fear stricken that even today if somebody does that riffing activity, I conditionally stop that from doing. Even today that sound is a annoying sound. So doctor that way is a conditioned response. To determine the spread of squamous cell carcinoma of midline of the lower lip via lymphatics, which lymph node you want to do? Otherwise, where will the lower lip midline will go to? Which lymph nodes? Submental group of lymph nodes are the ones which are typically affected, is what need to be remembered. Then similarly, doctor, this is also another important question recently asked in lot of entrance exams. In the neck, what is level 1, level 2, level 3 up to level 7 different groups of lymph nodes? Each of these levels you need to be quite sure in anatomy. 78-year-old undergone transurethral resection of prostate and you found benign prostatic hyperplasia. So which hormone is responsible for the proliferation of the prostatic tissue? It is the dihydrotestosterone. So 5-alpha reductase is the enzyme which is basically implicated. A 27-year-old from Tirupati with lesions covering the both labia. What is these lesions described as? Cauliflower-like lesions, which are typical of condyloma acuminata, which is caused by the human papilloma virus, lead to labial lesions which are typically cauliflower in shape is what need to be remembered. So that brings us to the end of the image and case based questions.